Watching Idaho's News Channel 7. This is the News at 4.
Welcome back to the News at 4. How the Central District Health Board advises the public about COVID-19 might look a little different. At today's regularly scheduled CDH board meeting, their COVID-19 advisory policy sparked a back and forth discussion, mostly between Board Director Russ Duke and board members Raul Labrador and Dr. Ryan Cole. Our Andrew Bartline has been following this story for us. Andrew, walk us through these changes.
Yeah, the board all agreed from the advisory of the CDH should be backed by data. But what data exactly? Typically, CDH board follows the advice of the CDC guidance. But if that guidance is contested by board members, members can call a special meeting per bylaws to modify or retract the advisory.
Headed into Friday's CDH board meeting, their public health advisory regarding COVID-19 was clear. It is the policy of the Central District Health's Board of Health that public health advisories issued by the agency should be based on scientific data. And this Wednesday, Board Director Russ Duke advised the West Ada School District by advocating for masks in schools.
CDC's recommendation is K through 12 mask based on the Delta variant. I do expect that will change for future variants depending on, again, how transmissible and how severe they are. But for right now, that would be my recommendation to you.
And that CDC data Duke based his advisory on, not every CDH board member agreed on, specifically Raul Labrador and Dr. Ryan Cole.
You know, if you want to repost what the CDC did, that's one thing. But when you're going beyond that and you're actually advocating for a position from the CDC, I think that needs to be voted on by the board.
Duke defended his actions at West Ada, saying it was his job to advise agencies and then let these agencies make a decision for themselves. But board members want a larger say in these advisories.
And again, I don't want to micromanage Russ. I appreciate what he does. And I just want to make sure what we at least have the opportunity to discuss, you know, based on which data are the decisions made.
Ultimately, a compromise was reached between Duke and board members by way of a pre-existing bylaw. Board members can call a special meeting, and in that meeting, board members will determine if they will leave the advisory in place as written, modify the advisory, or retract it.
They're asking me for my opinion. West Ada invited me. I didn't invite myself. They asked for my opinion. They asked for my recommendation, and I think it's our responsibility to provide it.
It's worth noting Dr. Ryan Cole voted to abstain from the policy after it was revised in a compromise, but that policy was approved. And the board also updated their social media policy, saying they will not repost content from an elected official to remain apolitical, even if that post is in the interest of a public health official. Like Governor Brad Little, we know he tweets about AARP or other things that are in public health interest. CDH board members recommended that their social media accounts don't repost sources like that and stay independent themselves.
Very interesting. Thanks, Andrew.